After the problem has been outlined, researchers take a deeper dive into the data to figure out what might make the problem better or worse. They do this by identifying risk factors and protective factors. Risk factors are things that might make someone more likely to have a negative outcome, such as becoming a victim or perpetrator of gun violence. As an example, smoking is a known risk factor for cancer because studies have shown smokers have a higher incidence of cancer than non-smokers. Health officials leverage this information to shape recommendations, policies, and programs to help reduce the number of people who smoked and, consequently, reduce the rate of cancer. Protective factors, on the other hand, are things that appear to reduce the risk of negative outcomes, in essence, what we should be doing more of or trying to expand. For example, exercise is a protective factor against cancer because research has shown that people who have a healthy range of physical activity have lower rates of cancer. Medical and public health experts use that information to encourage people to increase the amount of time they spend exercising every week. In the case of death or injuries related to firearms, risk and protective factors could vary widely, depending on the type of outcome being studied. While mass shootings often get the most media attention, there are many ways using firearms could result in injury, some of which aren't intentional. In addition to firearms being used for intentional harm, as in the case of homicides, mass shootings, and suicides, gun violence can also encompass events like accidental discharges. Researching risk or protective factors associated with these types of unintentional shootings could, for example, help identify things that might make guns less likely to unexpectedly fire, like user training or gun safety features, whereas studying what makes homicides more or less likely might reveal entirely different factors to focus on. It is important to note that while certain things might increase your risk of getting hurt by firearms, the presence of a risk factor doesn't mean that violence is inevitable or that victims are to blame when they are hurt.